Good evening. Good evening. Admit cards are out. Good evening. Admit card आ गए. Yeah, everybody's downloading the admit card. Wrong time. Wrong time? Should I cancel the class? But let's finish it. ठीक है. It's okay. I understand कि admit card आ गया. पर वैसे भी आप निकाल सकते हो. It doesn't matter. Right? Let's finish the class. It's okay. मेरी क्लास के टाइम ही ऐसा होता है. But I'm glad that admit card has come. All right. So you now know your centers. Everything has become very wait for some time. Do you want me to start the class? Do you want me to take the class a bit later? Or what I'll do is, listen. I'll send the annotated notes in the group. All right. And I miss you guys. Okay, and I'm very happy कि आपका admit card आ गया. Do you want me to continue? Let me put a poll and let's see. Let's do a poll. Okay, so let's. Okay, आज काम करते हैं. एक बहुत जल्दी खत्म कर देते हैं सेशन. Okay, let's just do it fast. ठीक है? Look at the first question. Let's finish it fast. Let's finish by 6:30. ठीक है? एक गाना याद आ गया? कौन सा गाना? Judicial hanging is a method of execution of a condemned criminal case. Cause of death in such a case is mostly due to. What is the answer for this? आज मेरे रेगुलर बच्चे भी नहीं आए. Okay, always remember, in the case of judicial hanging, there is full hanging, like the body will be hanging. Okay. So the cause of death will be the cervical fracture. Now please tell me which cervical vertebra will be most commonly fractured. That was also a PYQ. Can you please tell me which cervical vertebra is most commonly fractured? Pranay, thank you for coming. Okay, so you need to remember that in judicial hanging, position of the knot is either on the side of the neck or below the mandible, and it is also known as hangman's knot. And there is a cervical, directly there is a cervical fracture, due to which there is a injury to the basal this thing, right, brain stem, and the person will die right away. All right. And the another question that they can ask you is which court can give death sentence, which court, which is the lowest court for death sentence, which is the lowest court that can give death sentence. Can you tell me that? अरे यार, बहुत खुशी की बात है कि एडमिट कार्ड आ गया, तो डू नॉट थिंक ऑफ इट एज अ बैड थिंग. आई एम वेरी वेरी हैप्पी फॉर यू. चलो, कुछ अच्छा काम होने वाला है. यू गाइज विल गिव द एग्जाम एंड क्लियर द एग्जाम. ठीक है? तो you guys will become doctors. This is such an amazing thing. I'm so happy for you guys. ठीक है? So congratulations, admit card आ गए हैं. Very good. Yeah, sessions code. Very good. And which code can give? Which code can give? Which code can say कि आपको डेथ सेंटेंस दे रहे हैं? Which court can do that? Tell me, which court can do that? High Court. Very good. High Court can do that. So these 3-4 things are very important. Remember, C2 is axis will be fractured, and the reason why you have death is because of cervical vertebral fracture. Okay. Now let's go to the next question. Cherry red postpartum appearance. See, everybody knows this. This is carbon monoxide poisoning. Okay. This is carbon monoxide poisoning. I've written here for H2S, it will be bluish green. Okay. Cyanide, brick red, phosphorus, brown. Okay. So these are some important points. This we have already discussed. Dekh lo. Whenever sympathomimetic condition comes, okay, where the pupils are, how will be the pupils? They will be dilated, right? Pupils are dilated in this condition. Okay. Sympathomimetic in the sense कि यहाँ पर क्या होता है? यहाँ पर क्या होता है? यहाँ पर everything will go high. Heart rate will increase, BP will increase, there will be sweating. Okay, all these are features of your sympathomimetic acting. Okay, and this is most commonly due to cocaine. Plus, tactile hallucinations are seen here. All right. The next question: a person dies due to starvation. This is the cause due to. And what about your opioids? What happens in opioids? Can you tell me about opioids also? Sorry, this is Datura. Sorry. This is Datura. I didn't read the question. Trying to do it faster. But this is due to atropine poisoning. Atropine poisoning. Sorry. अरे I'm trying to do it faster और मैं ही पागलों की तरह. Look at this. ये देखो, ये सब दतूरा की वजह से होता है. दतूरा रिलीज करता है एट्रोपिन. सो दिस इज एट्रोपिन पॉइजनिंग ड्यू टू दतूरा. ओके. नाउ टेल मी दिस थिंग. What about the person who died due to starvation? Person died due to starvation. Which of the following will be seen in the autopsy? Can you tell me? ठीक है, मैं आराम से पढ़ाती हूँ. मैं भी थोड़ा लाइक इट्स सच अ गुड थिंग. एडमिट कार्ड आ गए. आपका एग्जाम सी. चलो लेट्स सी. व्हाट्स द आंसर टू दिस? ओके, लुक एट दिस. अच्छा, पीडीएफ लैग हो रहा है. A person died due to starvation. Which of the following is correct in such a case of autopsy? So remember here, all this, how can enlarged stomach or expanded lungs or enlarged heart happen when the person is starving? So the gallbladder will have bile in it. Okay. And this does not get released because the duodenum is not sending duodenum is not full, and cholecystokinin is not released. Due to that, the gallbladder will be distended. Okay. So this is the postmortem finding that you will see. Autopsy. Look at this. A person has committed crime offense. A person has committed criminal offense, caught by police and later brought to a criminal court. But the court directs police to transfer the case to juvenile. So tell what must be the age of the patient here? Very good. Remember, in juvenile cases, what is the age that we consider? We consider the age to be less than 18. Okay. And can you tell me which person this was asked? Which person under 18? Person under 18 can be tried as an adult. Can be tried as an adult. Can be tried as an adult. Can you tell me which person under the age of 18 can be tried as an adult? This was a PYQ. This is a PYQ also. Anybody? Who can be tried as an adult? अरे यार, मैं कॉफ सिरप पी के एक्चुअली दिल्ली में ना, what happened is, दिल्ली में कोल्ड बहुत हो गया. It's very cold here. So, and I have a very very bad immunity. Okay, so मैं cough syrup ले रही हूँ, I'm taking steam also. uh, I don't know if you can see it, I'm eating Vicks right now, so so yeah. So remember, a person at the age of 16 to less than 18 can be tried for heinous acts. Somebody who has done a heinous act, they can be tried by the court as an adult. Okay, let's go to the next question. Look at this. In Barbaros's test, yellow colored needles, yeah, heinous crimes. Okay, serious offenses, age should be 16 to 18. Now look at Barbaros's test, yellow colored needle shaped crystals are seen under microscope. This test, this is a one liner. Okay, so what is this test done for? It is done for semen analysis. Okay, it is done for semen analysis. All right, this is done for semen analysis. Dr. SF, okay, okay. Dr. SF, please contact me personally. A farmer was brought to the casualty with pinpoint pupils, increased secretions, and garlicky odor. What must this be? This must be due to? This must be due to? Very good, very good. This is atropine. Okay, this is atropine. What about this? A child consumes iron tablets used by the mother. Antidote to use such, we have discussed this. Remember, your desferoxamine is used for iron toxicity. Also, it is used in multiple blood transfusion. Remember, they can ask you about multiple blood transfusion or thalassemia trait. All three conditions, iron increases, and this is due to the antidote for that is that one. Okay. Now, gutter fracture of skull bone is associated with the impact of which of the objects? Gutter fracture. Gutter fracture. Gutter fracture, remember, it happens due to bullet. Okay, bullet firearm injury. What is a gutter fracture? It is a depression. It is a depression in the skull. Okay, depression in the skull. Okay, let me show you. I don't have it here. I'll just put the picture here when we do it. Okay, remember ring fracture. This has also been asked. Ring fracture. There is a basal cell fracture when there is a fall from height. And motorcycle fracture. This has also been asked. Hinge fracture from one side to the other side. So all three of these have been asked. So very, very important. Okay. Gutter fracture, ring fracture. What about your Pons fracture? Pons fracture. Is it really blurred? I have no idea what to do. Okay. I think maybe some issue with the net. Let me check in my phone. Let me check in my phone. It is clear in my phone. ठीक है? Okay. Yeah. Pons fracture baby में होता है. Pons fracture baby में होता है. Your fractures are very important. All of these are PYQs. ठीक है? So make sure you do it properly. Now look at the next question. In an unconscious patient with a head injury requiring emergency surgery, is there no relatives to give consent? The doctor should. Can you give me the answer for this? The doctor should definitely operate without consent. Remember, whenever there is a life-saving procedure, we do not need, as doctors, we do not need permission. Life for saving the life. Okay, if there is nobody else to give, okay, if there is nobody else to give us permission, we can directly do a life-saving procedure for them. Okay, look at this. A 40-year-old patient was brought to the police in an unconscious state to casualty with a history of unknown poisoning. Okay, on examination, needle track ulcers, blah, 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 blah. Remember, the bugs crawling will always be present, and this is seen in, plus symptomimetic, like I said before, in symptomimetic, everything increases, heart rate, your BP, your pupils are dilated. All these are features. And where is pinpoint pupil seen? In what kind of poisoning? Pinpoint pupils. Pinpoint pupils, you tell me, this is cocaine. Okay? Opioid. Very good, very good. That's in opioid. Now look at this. The partial hanging mimics strangulation in which way? Partial hanging mimics strangulation in which way? Very good, everybody. I see very familiar names. Thank you for coming. Very good, very good. Proud of you guys, okay? What is this? See, hand touching the ground is not a specific way. Transverse mark is seen over the line. Whenever we have hanging, right, the ligature, in low lying or partial hanging, the ligature is the most important. Okay, low lying or partial hanging, there is a transverse ligature mark. We think about the ligature mark more. Okay, so B is not the answer. The answer is A. Okay, blood pooling in the extremities happens in which? In full, like when we do judicial hanging, right? This happens in judicial hanging, right? So the answer is A here. Low lying or partial will have a transverse mark. Yeah, full hanging. Okay, so this is the answer to that. Now look at this. Medicine you will have on 7th or 8th. We will combine all the medicine questions together. Okay, all 3 papers. Now look at this. Which one were we doing? This is medicine. Patho we are done with. Okay, we are done with patho. Did you go through patho? Patho we are done with. And the next is anatomy. What is this? Identify the structure marked. Yeah, medicine we will do together. Okay. What is the answer? Remember, if they give you so many of options, right? Mostly they are talking about genioglossus. Mainly this muscle is genioglossus, plus it is the safety muscle of the tongue, right? So basically they will ask you more questions about it. Okay, and many times from anatomy, very few, honestly, if I tell you, only 5-6 questions come. You can see the paper, even in this, there were only 6 questions that were identified as anatomy. Okay, so because they get integrated by other subjects. Okay, now look at anatomy. Also, there was one question that they said, so let's read this out. They said there was a question related to collagen, and they asked about fibrocartilage. And people were confused whether, because cartilage comes in 2, and this actually fibrocartilage, it comes in 1, type 1. Your bone and fibrocartilage comes in type 1. Hyaline and elastic cartilage comes in type 2. Lymphoid organs like spleen, liver, etc. comes in type 3. These have reticular fibers, and type 4 has basement membrane. Okay, so just go through this. Chalega? This question had come in the exam. In your updated PDF, I'll update this too. Okay. Now look at the next question. All are paired cartilages except, this is such an easy question. Again, this relates with ENT, right? Today at 11:30, radio, is that okay? Radio question, all IBQs, and they are also PYQs. Not one question is not relevant to your exam. Not one question is there that is not relevant to your exam. Okay? Woohoo! I told you, right? I'll make sure whatever I promise, I'll do it. Today, 11:30, we have radio. Okay? Today, radio. Okay? If you have any doubts in those radio questions, send them in the group. But I don't think you should have doubts. Okay? All are paired cartilage except for your thyroid. All these are paired. What else is unpaired? Your epiglottis, your epiglottis and your, yeah, in the app, Okay, I am taking in the app, right? Okay, epiglottis and your cricoid. Now let's go to the next question. Which of the following is an abductor of the vocal cord? Thank you, Dr. SF. What is this? Also, can you tell me the other name of posterior cricoid? It is a safety muscle of what? It is a safety muscle of, and what do all these do? What is the action of all this? Action. Can you tell me? Can you tell me the action of these? Very good. Safety muscles of larynx. Okay? Larynx. And everything else are adductors. Only your posterior cricoarytenoid is an abductor, rest are adductors. Okay, in this question, remember, you need to just study this image, this part of the image. Okay, and you should know where is your caudate. So on the top is always your caudate. On the sides you have on the sides, what do you have? What do you have on the sides? Yes, very good, everybody. Lentiform, very good. On the sides you have lentiform, and below that what do you have? You have your thalamus. Okay, below that you have your thalamus and caudate also. Okay, can you see the caudate, your thalamus and internal capsule? It is here, right? This is your internal capsule. Okay, this is your internal capsule, and the internal capsule was asked. This is your internal capsule. Okay, so this image is very important. This is in my annotated notes. Okay, so you go through the image and just remember which one is on the top, which is on the sides. Okay, only that is important in this. They won't go deeper in this. All right, now injury to bulbar urethra leads to extravasation of urine in all except circle of Willis. Today there's a question on it. Today there's a question on circle of Willis. Okay, whatever is important, see, I always try to make sure to give it to you. All your radio questions of today, we gave it a lot of thought. We also brought it from NEET and INICET, the recent one. So you don't miss anything. Okay? Yeah, you have class at 8. 8:30, right? Okay. What is the answer for this? This is your deep perineal pouch. Very good. Everything leads to the extravasation of urine except your deep perineal pouch. What about this? This question was given. Can you tell me what is this question based on? What is this question based on? What is this question based on? Can you please tell me what is this question based on? What is this question based on? All the groups are filled with question. Yeah, very good. Axillary artery. Okay, this is based on axillary artery. Can you please tell me how is it divided into 3 parts? Because of which muscle? Can you tell me which is it divided into? Divided by which muscle? Can you tell me which muscle is it divided into? Pectoralis minor. Okay, that is also a PYQ. Pectoralis minor. So what is the answer for this? You look here. Can you see the branches? In the first segment, you have superior thoracic artery, which is present here. Okay, your superior thoracic artery is present here. Then in the second segment, you have two branches, that is thoracoacromial and lateral thoracic. Where are they present? Your lateral thoracic comes here. See, this is your first part, only one branch. Second part, you have two branches, and the third part, there are three branches, and they're given here. Okay, so please make sure to go through the branches everywhere. This question so many times. Any other question that is related to axillary artery, that is very important. Axillary artery. Any other question? That is very, very important. The PYQ is still not uploaded. There are few changes that I'm adding. Please understand, I'm not even sleeping. I'm doing it as fast as possible. But I'm sending you all the annotated notes, right? So everything is taken care of, okay? There are not much errors. Mostly it's like B, if the answer is B, it is given as C, but the explanations are right. 1-2 image, there was a problem. I made the changes in the annotated notes, right? So, but I will send it. Yeah, class is still 6:30 and we'll leave. Now look at this. Can you tell me other thing about axillary artery, radial artery? What things are asked from radial artery, axillary artery? Can you tell me? Thank Akhilesh. Okay. Tell me, guys, fast. Saturday night palsy? Yeah, I will do that. Saturday night palsy, can you tell me? Yeah, wrist drop happens due to what? Saturday night palsy happens due to what? Saturday night palsy. What else? What other palsies do you know? Shaft of the humerus fracture. If the shaft is given, they can ask you which artery is fracture. So that is your radial. Which one? Very good. So all these are very, yeah, clump case paralysis, wrist, radial, Saturday, very good. Okay, eighth thumb, point index, that involves. So all these are very, very important. Go through them. I will add it here. I'll add it here. All those points, I'll add it here. Now let's go to the next question. Cortical spinal tract crosses at. Cortical spinal tract crosses at. Crosses at. Crosses at. मैं डाल देती हूँ. मैं पूरे टेस्ट मंथन श्रीवास्तव. Let me put all the tests together. Okay, all tests together and send it to you. Okay, मैं डाल दूंगी. मेरे पास एक PDF है. Very good. The answer to this is again a one-liner, lower medulla. Okay, at the lower medulla, your corticospinal tract crosses. Okay, at the lower medulla. Again, this is a one-liner. Then Killian's diastasis is seen between. Killian's diastasis is seen between. It is seen between. Query, what you do is you message me personally. That's way better, because if I explain, it will take the time. And we don't have time. Like, I should end the session by 6:30, since your admit cards are out. Yes. Har Gobind. No issues. Okay, no issues. Yeah, this is cricothyropharynx. Remember, there is a diverticula in this. That is your Zenker's diverticula. And remember, it is a false diverticula. Also, it has clinical presentation like halitosis and other presentations. Again, it is seen on barium, right? And it is also known as the pharyngeal pouch. Okay, so all these are very important points related to that. let's go to the next question. Tell me this. A 3-month-old baby presents with mucus exuding from one eye on pressing the lacrimal sac. What treatment should be done? What treatment should be given to such a patient? What treatment should be given? See, for a patient who has mucus exuding, this is mostly due to congenital problem. And what you can do is, you can do a lacrimal sac massage 3 times a day. So what you do, you press gently here and then just do this, okay? And do this, okay? That's it. So the answer to this is lacrimal sac massage. After that, you can do all the other procedures. This, again, remember there is a greenish or brownish Kayser-Fleischer ring. This is Wilson's disease. We have discussed this many times. Okay. What about this? What is the answer to this? A child with history of malnutrition is examined and the following finding is noted. What is this most likely? Very good, very good. What is this most likely? Health will get better once I take rest, once I stop working completely. That will happen after 12th December, okay? So I'm not really worried much about my health because I know I need rest. I won't get well before I take rest. Okay, and that's not going to happen since I have so much work left. I'm making tests for you, mock test is there, okay, so this is our schedule. Tomorrow you have, let me remind you your schedule. Tomorrow you have image-based mock test 1. Tomorrow you have mock test part 1. Part 1, okay, at 5 p.m. On 5th you have mock test part 2. This is the last time you should take mock test and give it very fast, okay? And on 8th we have the last image-based test. Do you want us to keep any mock test after that? I don't think we should. I don't think we should keep any mock test after that. So this is your schedule. Okay, 3rd, 5th and 8th. See, more than giving you an exam-like feel, to be honest, if I tell you, if I keep the paper at 9:30, part 1, and keep the second part at 2:30, you will still not get that exam-like feel, because that exam-like feel comes at the exam time, okay? Anybody who's saying that I'll give you that exam-like feel, your heart will be pumping, you'll be sitting there, you would be worried, and sudden calmness would come, you will give the paper, you will feel better. All this comes on the day of the exam. So at this point, for me, something that is more important is for you to give enough time to give the test. Okay? I want you to give the test. I want you to get whatever you can from the test. Okay? कोई क्वेश्चन तो पढ़ के आगे देख के ही सॉल्व हो जाते हैं. Yeah, that's what. Okay, so yeah, OBG, tomorrow OB-Gynae, day after tomorrow Patho. We will increase the number of questions in this, okay, because we want to give you the maximum good questions. ठीक है? 150 marks practice करो यार. 300 mark का कोई पेपर नहीं होता. 150 mark practice करो. Even you get space in between 150 marks also, right? So no need to build that much stamina. Just get enough stamina for 150 marks. Okay? Okay, now let's yeah, app wale question try not to do. Okay? You will at this point, please do not give any app test. I request you, don't give any other app test at this point, because this, like, what is the date today? It's 2nd December. You have 9 days left, and if you go into depression at this point, this is not the right time to go into depression. Give our mock test. This is not for any kind of marketing. Okay, we are doing it all for free, so it doesn't matter. It's just that I don't want you to lose any hope. Okay? Okay. Anxiety movement hai. Just don't don't worry about it. Yeah, we know admit card came out. Okay, now look at this. This is a child with malnutrition. Okay, this is a child with malnutrition, and most likely they have a styloma, anterior styloma. Why? Because they suffer from corneal perforation and the whole cornea can come out. Okay, this is a classic picture of a styloma. Okay, I will send the other pictures of this together. Okay, this does not happen in starvation. Look at the next question. A 10-year-old child is diagnosed with amblyopia in one eye. What will be the best treatment? What will be the best treatment? आपने क्या बोला आपने? Yeah. See, now don't do any INISET, don't do NEET, don't do NEET, don't do INISET. These questions, see, from these papers, the easy question comes for our exam. So those questions can confuse you. The options can confuse you. So don't do. Just the PYQs that I'm uploading every day on app, right? I already selected NEET, INISET questions which are your level. Okay, and they are there in the app. Every day we told, right, we will keep sending questions. So make sure to go through them. Give the test daily at 11:30. 11:30 on app, you give the test. And I'm telling you, from these 9-10 days also, the questions will come. 100% they will come for your exam. Many of the questions will be repeated in your exam. I promise you this. You will come and tell me, ma'am, वो question जो आपने डाला था पेपर में, जो आपने PYQ 11:30 को लिया था, वो question आया था. You will tell me this. ठीक है? Yes, I know, Sameer Goyal, we are going to end this. देखो, मॉक में अभी कितने मार्क्स आते हैं वो मैटर नहीं करता, ठीक है? Do chanting. If you have not touched the subject, if you have missed some subjects, do PYQ of that and do chanting. That is enough now. That is enough now. You don't have time to read rapid revision notes. You don't have time to read. If you have done the subjects very well, then go through the notes. Okay, then go through the notes. If you have not read the subjects, I'm telling you, go through chanting and PYQ. Don't do anything else. And go give all the mock tests, give the mock test, because those questions will come for the exam. They will come for the exam. Last time, the mock test that we gave, at least 20 to 30 questions were just like that. They just cut, copy, paste. They were like that. So give the mock test, give the PYQ test that we are conducting, and you will get the same questions in the exam. Okay? PYQ कहाँ से करना है? ऐप में डाला है ना? ऐप में रोज 11:30 को PYQ अपलोड हो रहे हैं. Okay? Today we have radio. Radio is there today. Okay? Don't do anything else more than this now. अगर आप और see, at this point you should revise subjects which you're thorough with, so that exam के दिन आप भूलो ना कुछ. And don't learn anything new. No new thing should be learned now. At this point, nothing new should happen. Okay? So chanting and PYQ is enough, because that is a summary. And most of the questions come from that only. So you study that and pray to God. I will pray for you, and let's clear this damn exam. Okay? Let's all clear the exam. Okay? Can we move ahead, because I need to finish this. What do you do in this patient? What do you do in this patient? What do you do in this patient? Good doctor, I will reply you today. I'm so sorry. I will reply you today. Please send me a message again. Please. I'm sorry. Okay, I'm not getting time, but I will reply. Okay. See, the answer is, see, what happens? This patient, what do? You do occlusion of the bad eye or the good eye? What do you do? Occlusion of the good eye or the bad eye? What do you occlude? The eye with amblyopia or the eye without that? Which one do you occlude? You occlude the good eye you occlude the good eye, and automatically the other eye, it will become better, it will become stronger. ठीक है? तो जो पर्सन को दिक्कत होती है, जो बुरा है, उसको अच्छाई करने का मौका तो हो जाता है अच्छा बहुत बार। इंसान बुरे नहीं होते, हालात उन्हें बुरा बना देता है। ठीक है? Now look at this. Look at the next question. Which lesion of the visual pathway produces a macular sparing effect? Again, this is a very, very important question. Either a question of optic chiasma, occiput, optic nerve, optic tract. Every year, one question is repeated from this. And at physio, you can drop. It's okay. Physio, you need for medicine. Most questions actually get integrated with medicine for physio. Okay? So if you understand physio, then only you can do medicine. So physio is very, very important. Anat is not directly related to surgery, because you can do surgery questions without, because in surgery itself you'll learn a lot of anat. Okay? So focus more on learning physio. There's a rapid revision video of Ashish sir of physio. During my exam, I didn't get time to study physio. Okay, so I did that rapid revision video of 2 hours, and all the questions came from that. Whatever physio questions that I had in my exam, they came directly from that video. Okay, so the answer to this is occipital lobe. Occipital lobe, and that is your visual cortex. Look at this picture. Okay, what happens in your optic chiasma? There is a bitemporal hemianopia. And also one question related to optic chiasma. Can you tell me in which, like, bitemporal hemianopia, it is seen somewhere else? Can you tell me where it is seen? Okay, study solutions, I'm sorry. Actually, बच्चे हैं. I don't get much time to talk to them later, that's why. ठीक है? Pituitary adenoma, very good. See, you people know everything. Pituitary adenoma, ठीक है? And this is seen in your occipital lobe, where your visual cortex is. Macular sparing. Okay, so this is very important. Please go through this. Then look at this. A young male complains of watery eyes and on inversion of upper eyelid. On inversion of upper eyelid, following image is seen. What is this? What is this? What is this? Very good, Dr. Tabir. Actually, many people message me saying that, ma'am, this looks like trachoma. Okay, so why can't it be trachoma? So remember, this is your trachoma. Look at the appearance of trachoma and look at this. Cobblestone appearance is seen in your vernal keratoconjunctivitis. What about your bacterial conjunctivitis? What about your bacterial conjunctivitis? It will not have follicles, it will not have itching. Okay, and what else? And this is also seen, right? Arch line is seen in your trachoma. Arch line, plus look, differentiate the images of trachoma and your keratoconjunctivitis. All right? Yeah, sago. Like, it looks like sabudana, right? Look at this appearance. It looks more like sabudana. ठीक है? Yeah, very good, Pravesh. By heart कर लिया है पूरा. Look at this. Which of the following is the gold standard for measuring IOP? Which of the following is for measuring IOP? This is a very, very simple one-liner, and I'll show you the image of that also. This is the image, okay? This is the image. And also remember the normal IOP, that is 10 to 20, okay? This is the image of your IOP, and that is the gold standard. Tonometer is the gold standard. What is the treatment of choice for recurrent pterygium? What is the treatment of choice? Treatment of choice. Remember, if pterygium comes, when we are talking about pterygium, it is this, right? This is your pterygium. What you can do is you can directly remove it when it comes first. But what happens in most of the people, in maximum population who suffer with pterygium, it recurs back. So what you do is you do excision with autograft. Autograft means from the other eye you take the graft, okay, conjunctival graft, and you put it in this eye so that it does not reoccur, okay. So this is the answer, excision with conjunctival pterygium. And this is your pterygium. This has also come for the exam, okay. This has also come for the exam. Look at the next question. A lady present with sudden painful loss of vision which worsens on eye movement. Relative afferent pupillary defect is present on perimetry and central scotoma is seen. What is the diagnosis? What is the diagnosis? These are classical symptoms of your optic neuritis, okay. This is the classical. What happens in optic neuritis? What happens in optic neuritis? Again, this is very important for your exam. Again, classical question for classical symptoms: sudden painful loss of vision, worsens on eye movement, papillary, central scotoma. All these are symptoms of your optic neuritis. Look at the next question. A patient presents with a history of wearing contaminated contact lens with pain and photophobia. What is the most likely cause of this? Shubhangi, thank you. Look at this. This is definitely, whenever they talk about wearing contaminated lens, it is your acanthamoeba keratitis. Okay? Acanthamoeba keratitis. What happens in herpes simplex? There is a loss of sensation and it is a painless ulcer. Okay, they will talk about a painless ulcer. What about your bacterial keratitis? We already told. And in fungal, whenever vegetable matter is given due to vegetable matter and painful, that is your fungal keratitis. Okay? So all these are important. Just go through the one-liners. Look at this. A child presents with proptosis, pain and loss of vision. Again, this is a triad of a classical picture. Yes, very good. Very good, Sana, very good. It is a classical picture of orbital cellulitis. Okay, this is a classical picture. You don't have to. And look at the options. You know how sty is? When we were kids, we used to get it. It used to come somewhere here or here. It was very painful. Okay? And this is what? So all the other options, please go through them. But this is a classical picture of orbital cellulitis. A boy gets punched in the eye. Which of the following is the most likely occurrence? This can come as a one-liner or an image-based question or a IBQ. And this has been given many times. Very good. Yeah. Sty is for Z's mobile. Thank you, Sana. Thank you. Love you too. Very good. Inferior orbital wall. See, either they can give you this picture, and this is known as the blowout fracture, right? They can give you this picture, and can you see how thin the wall is? Can you appreciate how thin the inferior wall is? If you can appreciate how thin it is, then you will understand why it breaks. Why it is. Look at the lateral wall. It is so thick. Will it break? Look, compare all the walls with this wall. And you will understand that this is why, yeah. Yeah, teardrop also is C. Very good, very good. Now look at this. Look at the next question. A patient with the visual acuity of 1/6, more than 1/6, and but less than 3/60 in the better eye. What type of blindness does he have? What type of blindness does we have? We actually covered this in... Okay, okay. In this we covered this in PSM. This is social blindness. Remember, you always take the better eye into consideration. Can you tell me manifest what it will be? Can you tell me about economic and economic? What is manifest? Manifest is what is manifest? Yes, Manthan, very good. Manifest is 1/62. There is a table for this, na? I gave you in the annotated notes. Please go through them. Yeah, very good, very good. 12th question का answer definitely आपका inferior orbital fracture है. You can see in the inferior. Look at the fracture here. ठीक है? Look at this. A patient with a history of DM of more than 2 years comes with a painless loss of vision. This is given. What is this? Okay, this is a diabetic patient. Diabetic patient has come with painless loss of vision with the given fundus hiding. What is this? What is this? What is this? Confused हो जा रहे हो? Can you see? Actually, this is your PDR. Okay, proliferative diabetic retinopathy. What happens in that? There is neovascularization. Okay, there is neovascularization. If you can appreciate, you can see the blood vessels here. Look at the number of blood vessels here. There is an increase in the number of blood vessels. Okay, so this is neovascularization. This is proliferative diabetic retinopathy. Okay, cherry red spot should be seen in your CRAO. Okay, I'll you know what I'll do for this question? I'll make a table here. And I'll post all the important points. Plus, I'll post the images related to that. All right, just go through that. Can I show you all that? Yeah, very good. Tomato splash in CRVO. I'll send the picture. I'll send all the pictures together. Okay. In this one question, I'll post all the pictures here with the most important points related to that. ठीक है? फिर आप देख लेना वो. We will end the session soon. A lady presents with ptosis on eating and sipping fluid. Okay, her ptosis decreases. What is the most likely diagnosis? Cherry red and CRAO. Very good, very good. PDR is your proliferative diabetic retinopathy. Let me make a table and I'll send it to you in this annotated notes. All right. This is definitely your complicated ptosis. What is the name of your complicated ptosis? Look at this picture. When she opens her mouth, can you see that her ptosis has become better? What is the meaning of ptosis? There is closing of the eyelid. So what happened? It became better when she opens her mouth. Okay, this is seen in Marcus Gunn ptosis, and it is a kind of complicated ptosis. All right. In your Horner syndrome, there is a triad, right? ptosis, meiosis, anhidrosis, and okay. Yes, I'll do that. I'll do that. Where are you, Tuma Arun? I'll do that. Yes, yes. Look at this question. A newborn child presents with watery eyes, photophobia. On examination, the following picture is seen. What is the diagnosis? What is the diagnosis? Very good, very good. This is a classical picture of ophthalmosis. Ophthalmos, okay? This is a classical picture. Can you see the watery eyes? And and the and these are the two, and they're hazy. Can you see how hazy they are? Can you see how hazy they are? Watery and hazy. Only this image can come from there, okay? And there are two causes of it that's written here. So learn this. And what about this? Why? VY, what is used? VY, what is used? VY, what is used? For what is it used? Any idea? Again, direct one-liner. Okay. Some questions will be directly asked. It is done for ectropion. Okay. If the eyelid has come outward. Okay. So the answer is ectropion. What about this? What about this question? A 60-year-old male, breathlessness, tachy. Again, this is a question about your mucormycosis. What about this? Tell me about this. A patient presents with complicated cataract and the picture is seen on slit lamp. First, tell me what kind of cataract is this? What kind of cataract is this? Very good, very good. See, let me post cataracts here. All the other important cataracts here like this, okay? I'll post them here. This is your posterior subcapsular cataract, okay? Posterior subcapsular. Where is oil drop seen? Where is oil drop seen? Rosette is seen in trauma, okay? Rosette is seen in trauma. Oil in galactosemia. And senile? And senile? Yeah, very good. So you remember this very well. This has been done so well in chanting. Okay. Should we finish physio or should we finish physio? And tomorrow we will finish the whole paper. Okay. And then we will do all the important questions from the other two papers. Okay. So a female complains, they asked about production of milk. And there is not much logic to this. Production is done by prolactin and oxytocin does ejection. Okay, ejection of milk is done by oxytocin. The contraction to release milk is done by oxytocin and the production is done by prolactin. Look at this hormone that regulates serum calcium levels. बस ये खत्म कर देते हैं. There are very few questions in this. ठीक है, कल पूरा पीडीएफ खत्म कर देंगे. कल मतलब ये पेपर खत्म कर देंगे. All of them regulate. Okay, all of them regulate and all of them come in to action when there is hypocalcemia. Okay, there was a table that I made. When hypocalcemia happens, PTH is released. What does PTH do? Can you tell anybody PTH, what does it do? Pain in breast, pain in breast happens when there is contraction. Contraction, that is also due to, and there was a word of ejection or there was some wording where they said the milk was coming out. Okay, so on coming out of the milk, the pain was happening. So it happened due to oxytocin. Okay, oxytocin. Which drug is oxytocin? It is the drug of love. It is the hormone of love. Okay, life is for oxytocin. ठीक है? All right. PTH, your parathyroid hormone. I actually made a table here now. Wait, I'll show you. I did it before. We had that question before. I'm not able to find it, but basically, wait, I'll show you. One minute, just let me show you. I made it here. I remember I made it somewhere here. ठीक है, छोड़ो उसको, छोड़ो. Let's go to the next question. I'll show you what happens, okay? Where was the other question? Yeah. I'll show you how. I'll send you a table regarding that. That table is very important. A monkey is having increased sexual activity, increased appetite, anger and no fear. Injury to which of the following structure? Ritesh abhi gaya hai bahar. Tell me, what is the answer to this? This is? This is? This is? This is? Where were we? Yeah. This is your amygdala. Okay, the answer to this is amygdala. Ashish sir always tells that your amygdala will increase your anger, your sexual appetite, your appetite. So don't be like an animal, okay? He always tells us this. Which of the following reflex was performed by a scientist for various neurological and cardiovascular tests on monkeys? Remember, this is a one-liner again. Okay? It will not get repeated, so this is not important for your exam. Okay, this will not get repeated again. What about this? Why can't free hemoglobin pass through glomerulus? Free hemoglobin pass through glomerulus. This is due to it being a large molecule which is bounded with a protein. Okay, that's why it does not pass. What about your dopamine? Remember, again, we did this in pharma. It has renal vasodilation. Okay, your dopamine has renal vasodilation. At low dose, D1 receptors are activated and they are in the kidney. Okay, they are mostly near so renal blood flow is increased due to vasodilation. Okay, what about this one? This has come so many times I cannot even tell you. Either they will ask the production or... So what is this? What is this? Production. Production. Such a simple question. There should not be a mistake in this. Okay, it is a type 2 pneumocyte. Okay, so please, I think we are done with the questions. We will do biochemistry. What is left? Biochemistry is left. Biochemistry is left and psychiatry is left. Psychiatry, ortho, biochemistry, pedia. Okay, these we will do in the next class. You go, you finish your, look at your admit cards, be happy that your admit card came. Okay, we'll end this session here. I'll send you the annotated notes soon. Okay, go through them. I'll put all the important points in that. जो भी important images भी है वो भी. और आज रात 11:30 को radio test, and tomorrow 5 p.m. we have mock test part 1. Okay, I pray for you, all of you who attended, everybody, all the FMGs, we will clear the exam. Okay, we will clear the exam together. All right, take care. I love you guys. Best of luck. और अब की बार 150 पार. ठीक है, अब की बार batch code is free mock test 21, free mock 21, and org code is QQHAB. Okay, we love you. We are just praying for you. ठीक है, I'll post this annotated PDF before 10 p.m. ठीक है, you also take care. पहला पेपर अच्छा करना, ये जो मॉक टेस्ट दे रहे हो अच्छे से देना. ओके, टेक केयर ऑफ योर सेल्फ. लेट मी से गुड बाय टू यू. ओके.